And in this inaugural session, we are joined by two luminaries, Dr. Manohar Agnani, who is the Additional Secretary, Ministry of Health and Family Welfare, and Ms. Vandana Yadav, Secretary, Industries, Commerce and Enterprises Department, Government of West Bengal, and Managing Director, WBIDC. And I first have the pleasure of inviting Dr. Agnani, who is a medical doctor and an IAS officer of the 93 batch, with a master's degree in international health from University of Copenhagen. More than 18 years of experience in the field of public health and a keen interest in health system, strengthening nutrition and gender issues. Currently working in the capacity of nodal officer for COVID-19 vaccine in the country under the National COVID-19 Vaccination Program. With over 1.85 crore doses of vaccinations already done, this makes India the largest inoculation drives in the world. Dr. Agnani.
Thank you, Dr. Gursharan, Samir Kochaji, my colleague Vandana ji, dignitaries. So it's a privilege to be talking to you on this important milestone which we all have achieved together. This is a victory of all efforts which have been done by Team Health India, we call it. I won't take much time, but as was introduced, I have a public health master's degree, and I have worked for many years in public health in different capacities in my cadre, which is Madhya Pradesh, and also in Government of India, where I am posted since last 4 to 5 years. I have never seen a very systematic program like one which we are discussing right now. That's National COVID Vaccination Program. I must tell you the basics. We started in a very systematic manner. We constituted a committee called NECVEC, which is chaired by even today Member Health Dr. V.K. Paul and Secretary Health. It has representations from state governments and different ministries. We went very systematically, right from the formulation of the policy to seeing the production capacities of the manufacturers, giving them incentives, and finally, making a resource which can be utilized to the fullest extent. You all are aware that Ministry of Health and Family Welfare was doing vaccination earlier also, but it was limited to the vaccination of children largely and pregnants. We had a system which was digital. It used to monitor the vaccine management called EVIN. And I remember clearly that when we started this vaccination drive, people had a lot of apprehensions that will Government of India be managed to do a vaccination of entire population, which requires huge logistic arrangements. Probably we do not have any system to record every capture, every vaccination. We have been doing only the vaccine logistic and management. We have never done a name-based tracking of vaccination and so on. So we were very confident. It's not, I'm saying today, but we were confident for the reasons. We had reasons to be confident because we had experience of doing universal immunization program in the country. We also had experience of managing the adult vaccination in campaigns mode. You remember the measles rubella campaign and the Japanese encephalitis campaign. So we were very confident. We were also confident about logistic management. But this COVID vaccination gave us another opportunity to revisit our entire effort. We actually went on seeing our infrastructure in terms of the cold chain and augmented it as and when required, state-wise, district-wise, region-wise, even the cold chain point-wise. 29,000 cold chain points we revisited again, seeing what are the gaps there, how we can strengthen them. From day one, we were very sure that we will try to track every individual because we don't know what is the nature of vaccination. Today, we are starting for the primary vaccination. Tomorrow, we will need boosters, additional doses, precaution doses, time intervals. and this is very critical for a new vaccine. It is not a simple thing to do. So we graduated from even to COVID. We started with creating a beneficiary module where a name-based tracking is possible. You all are witness to this. You all have got vaccinated. You know when you got vaccinated, which vaccine, by whom, which CVC, on which date, what was the number of that vaccine. Everything is available. So I must say that we created a beautiful platform called CoWIN, which we gave to the international exposure. It is freely available for all other countries to do that. I must also say that when we started our vaccination drive, we came out with the guidelines. We calculated what is the HR, numbers of people, vaccinators do we have in public sector, in private sector, how many we need, how many vaccinators we need to train. We got the training modules done. We came out with the vaccine strategy, communication strategy, because we wanted to focus on 4 things. There was, normally you encounter a hesitancy when you go for the vaccination, but this was different in a sense that along with the hesitancy, you had eagerness also. People were wanting to get vaccinated first. So we came out with the guidelines. Who will be vaccinated first? Of course, it would be healthcare workers and the frontline workers and 60 plus, which are the most vulnerable population. And we systematically expanded this population to be covered. Then we covered 45. We all are witness to this. And eventually 18 plus, 15 plus, and 12 plus population, entire population is now eligible, who is 12 plus of our country. I must say that 185 crore vaccination is not a small thing. 96% of our eligible population has got at least 1 dose. 83% have got the 2nd dose. And we were constantly monitoring. And I must remind here, those are new to the vaccination journey of country. We have a systematic and beautiful model which was given by Honorable Prime Minister of India. We call it Mission Indradhanush. You are aware of that. When we try to do the line listing of all those who are missed by the vaccination, we do it for the children. The same vaccination strategy of Mission Indradhanush, we adopted for COVID vaccination, and we started with the Har Ghar Dastak Abhiyan. We train our manpower to actually go and do a household visit, try to see who are left with the 1st dose, who are those who are eligible for 2nd dose and have not come for the vaccination, try to remove the vaccine hesitancy, and let's bring a system where we give them the best possible opportunities to get vaccinated. Har Ghar Dastak campaign, we started on 3rd of November last year, was a huge success. This was actually based on the model of Mission Indradhanush, which was given by Honorable Prime Minister. And that is not a small thing. If any policy is to be formed, all these components which I am saying, a systematic policy formulation is very, very important. And so is the implementation. And I must tell you, if I recall the days when the vaccine availability was less in comparison to the demand, how we distributed it, how we used every drop of vaccine, how we managed this vaccine to be equally distributed as per the demand and the cohort which is available in districts, in cold chain points, in vaccination centers. We could do it successfully. And I'm very proud of this journey. And the entire credit of this journey goes to Team Health India, which includes public, which includes private. And I must say, the private hospitals, private CVCs, people volunteered, people came together, and a combination of a vision of Honorable Prime Minister, a strategy devised by NEGVEC, systematic work done by state immunization officer, state teams, district teams, Government of India teams. I must also bring and acknowledge the various partners, World Health Organization, UNICEF, UNDP, Bill and Gates Melinda Foundation, many civil society organizations who are working in the field, in the states, in the district, in remote areas, how they help us in reaching this last to mile uh, uh, coverage of vaccination. We also use drone for that matter. We are all witness. We have done excellent work. And if I have to compliment, if I have to give credit, it is all of us together who deserve a big success. Thank you very much for giving me this opportunity. Privileged to be here. Namaskar. Jai Hind.
Well, Dr. Agnani, thank you very much for apprising us on the efforts made for the COVID vaccination program. This is indeed, not only world's largest, one of the most concerted and monitored program. Nothing has fallen out even as a dry leaf from the program which has not been noticed. So my congratulations to you and look forward to further scaling. And this is going to be a learning for almost every single other government in the world. Thank you very much for being with us. I now move on to invite Mr. Raju Mishra, who is Joint Secretary, Industries, Commerce and Enterprises Department, Government of West Bengal. He is speaking on behalf of Ms. Vandana Yadav, who is Secretary of the department. Mr. Mishra.
Thank you so much. A very good morning to all the distinguished members, especially to Mr. Kochar, Dr. Dhanjal, who is our moderator, Dr. Agnani sir, and all the other distinguished panelists who have joined us today, and all the delegates who have joined this particular session. At the very outset of this, I would like to thank once again and our deep appreciation with the way Dr. Agnani and the entire team has taken up the COVID vaccination program. Moving on to our project for which I am here to speak specifically. So we all know that sand mining in general, in comparison to the other minerals, the biggest problem which we faced with regards to sand mining was that sand is available everywhere. And as was pointed out by Mr. Kochar, that has led to environment degradation, that leads to a lot of issues. And time and again, throughout the country, we have seen various reports regarding the illegal sand mining operations that occur and the issues therein. So our biggest challenge that was there was that till now we had a very fragmented system where each district had a separate way of handling each challan and enforcement, and how the royalty and other revenue was collected from the sand mining thing. So a mandate was given to the West Bengal Mineral Development Corporation, which forms under the Industry, Commerce and Enterprises Department, to streamline this entire process with the major objective of an environment-friendly sand mining practice and to provide affordable sand to the development sector. So for this, the first thing, we went part by part, and let me tell all of you that whatever estimations we had in the beginning, when we started the project, all of them were far outbeaten by the final numbers which we arrived to, which I'm going to come in the second part of the presentation to you. So when we started, we had an estimation that maybe around 5,000 or 6,000 vehicles would be plying or would be involved in this process. So we went for a vehicle registration, and we created our portal in such a way that if a vehicle is not registered, then they will not be able to transport sand in the state, or for that matter, any other minor mineral in the coming days. So the estimation which we had of around 5,000 vehicles, when we went for registration, it rose up to nearly 60,000. 60,000 plus vehicles were in fact registered on our portal. The most important thing that we did from an enforcement point of view and to ensure sustainable sand mining practices was a uniform system was implemented across the state. A QR enabled challan system was implemented so that any district authority, anywhere, any enforcement agency, be it the transport wing, be it the police, be it the district authorities, be it the revenue administration, they can buy a single QR code. By scanning it, they'll be able to know whether the challan is genuine or not. These challans, they were timestamped and they were also geolocation based. So for instance, depending upon the distance over which you are going to transport the sand, on that basis, you were allotted a specific time within which you had to transport the sand. Coming to the most important part of ensuring the legal mining, we created an online system of registration of all the existing sand carts, and we provided them the option of making a single window payment for all their royalty and all their other statutory payments. Now, this in fact reduced the business compliance from a lessee point of view to a huge extent. So the legal sand miners were incentivized to come into the system, and earlier they had to go to various establishments. For instance, they had to go to the bank to submit their income tax. They had to go to the treasury to submit their royalty. They had to go to the DM office to collect the royalty challans. And now the entire thing was made online into a single window system. So that heavily reduced the business compliance part for the legal sand miners. And at the same time, any and every illegal miner was thrown out of the system. So none of them were allowed to legally be a part of our system. And therefore, it made easier now at the district authorities and at our enforcement level to check any of these illegal mining systems. They did not have access to any e-challan. They did not have access to our portal. So they were sidelined. And that, in fact, has over the past 6 months, our revenue figures from these legal miners, it has now come to nearly 4-folds. So we have increased our revenues for the state from the sand mining portal. We have increased the amount of legal sand mining and the sand that is being provided at a very affordable rate through sustainable sand mining to all the developers. A very big issue that needs to be understood that for this particular sector, many people are not very well versed with the online system, and many of them are very small time players. So we had to undertake very thorough training of these people, and we had to make our software very, very simple, OTP based software. We created a secret PIN for them, which they could use again and again. And we also had to make a lot of tweaks to the software because we are also operating in very, very remote districts of West Bengal, where sand mining happens. So all those unique innovations were a part of a system, and we changed it on the go after speaking to the various legal sand miners. And the second thing was that sand mining, which I've said right in the beginning, it is not restricted to a single zone like coal, where it is easier to control. So using ICT, which is our biggest power, and along with the training of our enforcement team, along with the sand miners and the district teams, we have been able to achieve this project. And we are hopeful that in the future, so because of the success of the project, now the state government has decided that we are going to implement it uniformly across all the other minor minerals. In addition to that, we have brought in other layer of enforcement in the form of drone surveillance and RFID tagging, so that each vehicle can be tracked. And we can also go for night surveillance of these specific zones and areas. So we are building upon the success of the project. And I hope that we can learn some other best practices from all the other projects that will be presented today, and we can take this project to new heights. I thank you all once again for this opportunity to present our project to all of you. Thank you. Thank you so much.
Well, thank you very much for taking us through your experience. The interesting part, which is what I find, that you have incentivized these sand mining businesses. How did you actually go about doing it? I mean, if you could tell us a bit more about it.
Thank you. So what used to happen earlier was that if there is an illegal mining going on, so these legal sand miners who have paid legally to the government to carry on the sand businesses, they were at a disadvantage. And second, since there was no way of differentiating because the challans and all were offline, so at times it was very easy to counterfeit it. And third, for the legal sand miners, they had to visit various establishments to make their respective payments for their royalty, cess, DMF, IT, and other returns. So the first thing we did for them was to make it into a single window system where they could go and make the entire payment at one go. Second, we made the centralized uniform portal across the entire state, which did not allow access to any of the non-legal miners. And third, by the security features in our e-challan in the form of QR code, having dedicated enforcement module with our enforcement teams, the problem of counterfeiting of these challans was removed. Therefore, through these three steps, we have incentivized our legal miners, and that has led to a huge increase in our revenues and the legal sand mining.
Well, thank you very much. So I sincerely thank Dr. Manohar Agnani, Additional Secretary, Ministry of Health and Family Welfare, and Mr. Mishra, Joint Secretary, Industries, Commerce and Enterprises, Department of Government of West Bengal, for sharing your thoughts with us.